Hello, and thanks for clicking on this Spectrum Health COVID-19 update. I'm Leon Hendricks. We continue to see the number of patients hospitalized with COVID-19 move in the right direction, but we are not in the clear just yet. And we'll talk about the next phase of COVID-19 and what that may mean as the virus loosens its grip on our lives. With us now to talk about the latest, Spectrum Health West Michigan President Dr. Daryl El-Moushi. Dr. El-Moushi, let's start with the status of things at our hospital today.
Yeah, so I'm happy to report, Leon, that after 83 days, since mid-November, we've been in red status, and after 83 days, officially, as of today, we are going to yellow status. That means that our operations, while they're still interrupted, meaning that we still have staffing shortages, a lot of patients with COVID and so forth, things are definitely getting better.
And let's talk about where we are in terms of those patient numbers. I think we've seen below 300 for a stretch of time now.
We have. So I think last we spoke, we were in the 300s, and now we are definitely below 300. Remind you that in mid-December, we were at our peak, which was over 500. And so we are definitely seeing slow but steady improvement in our inpatient COVID census, which is great news for everybody, for the community and for our teams. And things are just starting to feel not normal yet, but definitely better.
And I know that there's going to be some people who look at this video and say, Dr. El-Moushi said the pandemic is over. I want to give you a chance to be extra clear on what this means for us.
Yeah, so first I want to remind you that these statuses, they're not official. There's no CDC guide to a hospital or health system status. These are internal measures, and we are saying very officially to our teams that things are getting better, but they are by no means normal. The pandemic, sadly, is not over, but we are very hopeful, as we've talked about before, that we're steadily shifting into a different phase of the pandemic where things are more manageable.
What does this mean for the public and their interactions with our system and our hospitals?
Quite honestly, as of today, not very much will be different. So we still have visitor restrictions in our hospitals. Those will hopefully change in the coming weeks or month or so, but that's much more based on community positivity. And I want to remind you that we used to be very upset when the community positivity got above 5%. We were floored when it got to 40% with Omicron, and we're still close to 20%. So we have a ways to go. So still we'll have some visitor restrictions for the time being, and absolutely everyone in a healthcare facility has to wear a mask. And so that's not going to change anytime soon. But I really hope you find that maybe some of the waiting times for some of our services might be less. And if you could see under the mask, you might see a few more smiles from our team members because they might feel the burden is a little less as well.
Right. I know we watch closely the numbers, and we have seen them go down significantly in the adult sphere, but still on the kids side, the numbers are still some of the highest we've seen. Talk about that, and why do you think that is?
Yeah, so, as we've talked about before, over the last probably 3 weeks, we've seen a peak at Helen DeVos Children's Hospital in terms of the number of kids admitted who have COVID-19. We peaked in the early 30s. We're still in the mid-20s. And for most of the pandemic, we were in the single to low double digits. And even during the Delta surge, I don't think we really cracked 20. So we are definitely seeing more kids and kids who are quite ill on the ventilator and so forth with COVID, hoping that gets better soon. And I think it's really a testament to the transmissibility of Omicron. So while we've seen in the news and we've felt it ourselves that this variant is less severe in most people, it's not less severe in everyone. And as a matter of fact, yesterday reported all over the national news that we're now hitting records again in the number of deaths in the country. That is all related to Omicron. It is the fact that even though Omicron is less severe, when 3 or 4 times as many people are infected at the same time, you are going to see some that succumb. And I think we're seeing a fair number of kids, particularly unvaccinated kids, that are coming into our hospital getting really sick.
Mm-hmm. Another headline I've seen nationally, you talked about the deaths, but also I think there were reports that Dr. Fauci talked about the fact that he thinks that this last surge is going to mark the beginning of the end of this being a quote-unquote full-blown pandemic. Some folks would like to have mask burning parties because of headlines like that. Can you talk about why that certainly isn't our advice at this point?
Yeah, so, it's a little bit of the tale of two cities. I applaud those comments, and I think we've been looking at our data, looking at national, international data, and really thinking and hoping a bit that as we come out of this Omicron surge between vaccinations, between prior infection before Omicron, and definitely, we all know so many people that have gotten sick over the last 6 weeks or so, that we hope there's so much community immunity, that's a little bit of a pun, I guess, or a little run on there, that with all of this immunity in the population, that we might not see these huge surges again. Instead, we'll see a little bit more kind of normalcy to how this disease spreads, more like flu. We hope that happens, and if that's the case, we think things will get better as the year progresses. With that said, we still have community positivity near 20%. We still have hospitals with hundreds of people sick with COVID as of today, both here in West Michigan and across our state and the country. So I wouldn't say that things are going to be normal soon, but I think things are going to get much more normal. And like we've said all along, we're all going to learn how to live with this virus and not necessarily cower away from it as we did right in the beginning when we knew nothing.
As we talk about where we're headed with COVID-19, one of the words I've been hearing mentioned a lot is endemic. I'm hoping you can provide some context as to what that means.
Sure, and it gets really confusing. There's multiple definitions out there. I think the easiest way to think about this is with a pandemic, there is a huge amount of illness all at the same time, really around a huge geography, or in this case, really around the world. Endemic is much more where diseases settle in. They're there in the background. Think of chickenpox. It never really goes away, but we don't have these huge spikes that are happening all over the country or the world at the same time. When you think of influenza or the common flu, we get surges that sometimes happen in the winter months, but nothing as severe as this, and it's kind of always hanging out in the background. I think the best way for all of us to think about this is we're going to learn to live with an endemic COVID, whereas with pandemic COVID, we've been all trying to figure out how to get rid of it. It's never going to go away. It's just going to get better and better.
All right. Spectrum Health West Michigan President Dr. Daryl Almushi, thank you. As always, we're keeping you up to date at spectrumhealth.org. Just go to the website and search COVID-19.